At the outset, I would like to thank a special thanks to Dr. Purvi, who could arrange this IC, although an odd time, but still, I'm happy that at least, I can see few young and elderly surgeons in this hall. And all my previous speakers have covered most of it. I'm just going through, run through a few ideas of mine, which may be theoretical, maybe in future, over a period of time, it could be, applied. So in my opinion, mentoring is basically a brain to pick, ear to listen, and push in the right direction. So it helps us to manage the relationship. It encourages each other, nurtures, teaches, offers mutual respect, and responds to the mentee's needs. And I'm sure you'll agree with me that a mentor is one who sees more talent and ability within you than you see in yourself, and he or she brings it out. And in ophthalmology, yes, mentoring is a serious business, both academically and surgically. So let's quickly go through what was the origin of mentoring. The king Odysseus had his friend whose name was Mentor. So when he went for a Trojan war, he introduced Mentor to his son Telemachus, who became an excellent assistant or an excellent prince who could manage army. Next came the Alexander, who at the age of 13 had a mentor, Aristotle, and who taught him politics. And we should be very proud to say that the key architects who shaped India and the destiny of modern India were none other than Mahatma Gandhi and Jawaharlal Nehru. And world Olympic cyclist, Lance Armstrong, his mentor was Eddie Merckx. So in my opinion, mentoring is extremely important. What exactly is the mentee-mentee relationship? The goal of a mentor is to ignite the constructive spirit of a mentor and encourage the mentorship. So the potential mentors should become ideal mentors, not that we are all good mentors or mentees, and the potential mentee should gain the right knowledge from the mentors. So what are the expectations of the mentor and the mentee? There could be very good expectations which are very useful. You take what you want and just throw away what you don't want. Sometimes there could be unhelpful expectations like, wanting too much, which can really create an havoc between the mentor and the mentee, and which is, I think, in the current scenario of medical colleges and institute is the case. So the expectations of the mentor, are they important? Of course they are important. Mentoring does matter. Why is it running? Mentoring does matter, and the art of mentoring requires two things. One is a skill, and the other one is an attitude. Now, do we have an answer to all this? No, we don't have it. But as a mentee, there are a few expectations. That's be available, provide them the right direction, support the peers, and be a little professional. Okay? Being a mentor is definitely a challenging task. Now, what are the expectations from the mentor? I'll just run through quickly one by one, because I think the next session people are already in. And I'm lucky to have them because they're wanting us to vacate the hall. So understanding the student and developing a comfort zone, which is so important, which is not seen in nowadays. We as students saw this. That's why I'm talking about this. Understanding the platform where the student stands. We all think that the student who has come, is meant to read and come, but it doesn't happen. And can we not perform few tests to understand where the student stands and what is his knowledge? And most important thing is take the decisions of what is to be unlearned and relearned, which I think is important. Can we not start from a scratch? Yes. If I remember, what I learned in my postgraduate days is still there with me, last 40 years. And you'll agree with me that the first lessons learned from the mentors will remain the longest. Eye contact is so important. In this era, where there are all gadgets available, knowledge is available all over in bits and pieces. Can we not have consistency, confirmation, and repetition, which is the key of success? Patience. All my previous speakers have said how much of patience we should have. Let's try again and again. And not all formulas work for every student, right? Some may be, extremely intelligent, some may be very smart, some may be dull, some may be over smart. We know all this, isn't it? Can we not listen to the students? Because they are the wonders and they have excellent imaginations which we cannot think about it. Give them time to breathe. I think in medical colleges, they don't have time to breathe. And consolidate what we are teaching. Homework, extremely important. Even now, when at this age also, when I go back home, I write down in my notebook what I have done today and what I'm going to do tomorrow. The younger generation might write it on a PC or in their mobile. But we all know that practice makes a surgeon better. Isn't it like driving a car? If I don't drive a car for 2 days, I really don't know where to hold the steering. I don't know where is the brake. So quality comes with careful planning, allographic approach, and meticulousness which every surgeon must have. Difficult surgery should be introduced early so that the worst scenarios are not dreaded. Keep checking your homework and keep updating yourself. There's, you can learn every day. Holistic approach, which is lacking so much. Surgical steps, complex surgeries alone are not enough for you to become a very good surgeon. Before you plunge into this big bad world, equip them with basic artillery. Lead by example. Embrace all the limitations of yourself and your student. Last, pardon them, excuse them when possible, punish them firmly with positive lessons, cover wherever you are required. You cannot expose your student or you cannot expose your colleagues, which happens very frequently, and I'm sure you're all aware of it. And humiliation is never the answer. Can we not think of passing over the baton? This can happen only if you have a very good relationship between the mentor and the mentee. Okay, pass the knowledge, teach whenever an opportunity arises, and find interesting grounds and collaborate with the next generation. So this is what, I think an ophthalmologist need to understand in a nutshell. Role of a mentor is so important. You can act as a role model, a door opener, a teacher, a guide, a counselor, a coach, a motivator, and of course an advisor. What is a mentorship skill? A mentorship skill requires a trusted friend and an advisor, skills needed by an effective mentor and skills needed by an effective mentee are equal, almost equal. Listening actively, both of them have to listen actively, building relationship and ability to encourage. When a mentor encourages the mentee can also encourage a mentor. It's vice versa. So there are some workshops of mentoring, which I'll not go into the depth of it. Understanding mentoring process and skills required for mentoring. There are different types of mentoring. In brief, I have just covered 3 types: the peer mentoring, the group mentoring, and the professional mentoring, where the difference between the mentor and mentee is just a little, age difference, very little age difference, almost of same age. Group mentoring, where we are mentoring many people, and the professional mentoring, where the major difference is in the life experience. Coaching and mentoring are 2 different aspects. Coaching means you're developing a skill which is very specific, whereas mentoring is for a career and it's a broader term. So at the end of the day, can we ask, our mentee, did mentoring help you a great deal? Can we not make it clear to a mentor that I want to become just like my mentor? This is a question that I would ask my mentor. And I think the person whom I was mentoring was good enough. So I really learned something from my mentor. And mentoring, let me tell you, I would conclude saying that mentoring is not a counseling service. It's not a drop in the advice center. It's not an academic tour, neither it is not an answer to all the problems. So mentoring is a two-way street. You get what you put in, and it's really difficult to find a good mentor and impossible to find a good mentee. And let me conclude saying that mentor is just a facilitator. So the ultimate secret is we grow when we teach. Thank you very much for your attention.
Thank you, madam, for those excellent tips of mentorship, and that was a very important word that you used, that is role modeling. Because no matter what we teach and preach to our students, if we ourselves do not practice it, the students are not going to learn it, because only a part of the transfer is through teaching and preaching. The most of the skills are learned by observation. Thank you.